All right, let's start. So, good morning, everyone. Myself, Dr. Disha Shah. I'm a child psychologist and special educator and founder of Vritti. It gives me really great pleasure to invite Dr. Tejal Panchal. She's an MD in Ayurvedic and she's also, um, uh, she's, I'm sorry, she's Ayurvedic lifestyle consultant and as well as diet management. She has also completed
Right.
her post-graduation diploma in clinical cosmetology. Apart from that, she has a specific skills in mixing Ayurvedic medicines preparation. As she's currently practicing at Shril Wellness in Mumbai, and her with a core emphasis on Ayurvedic lifestyle management and diet planning. Her introduction would be really incomplete if I don't talk about her brand, that is Rumraveda. She's a co-founder of Rumraveda, and she has prepared 6 beautiful skincare products that are immensely helpful for people who use it for their daily lifestyle. And the
Right.
very important, she's a mother of a really 10 months old cute baby girl. So today, we welcome you, Dr. Tejal. Today
Thank you
she's
so much.
so yeah, thank you. My pleasure. Today she's not just going to talk only from the Ayurvedic perspective, but she's as a mother, she has nurtured her own baby and how she is using Ayurvedic knowledge and expertise and in upbringing her. So before we start, a little bit about Ayurvedic. I'm not the expert, but all I know is Ayurvedic is really a traditional medicines, and now there is a modern science. So all I viewers to I request them, don't mix them all, don't mix Ayurvedic and medical science. If you believe in Ayurvedic, you can follow these techniques, these steps, and if you are a believer of modern science, you can practice that. There is no harm. All she's going to do is share her expertise and knowledge and how it is benefiting her and her daughter. All right. So Dr. Tejal, my first question to you is, how was your experience with your own daughter, in terms of Ayurvedic? Is there anything that you are specifically doing with her now? She's 10 months old.
So I'll tell you, first of all, thank you, Dr. Disha, for welcoming me in this program. And it's a great honor to be here today because sharing the ancient tradition of Ayurveda, which is there in our text, Indian text. But generally, we don't follow it because we are very hesitant and being very frank, people are unaware about it. So when I was studying Ayurveda, I was not a firm believer of Ayurveda. But when you actually go in the core and you understand what is the benefit in your daily life and how you can actually mold Ayurveda in the modern world or modern life. So that is when I understood when I delivered a baby and now getting, the ancient traditions now I have to follow with the baby. It's not that difficult. So today I'm going to share you a
You
few things, where practically we can do what with the newborn and how we can take care at the best with the Ayurvedic traditions. So yeah, I had a great fun. So I'm very happy to share this today with
all,
all of
all
you.
right, great. Thank you, Dr. Tejan. So my first question to you is, a lot of mothers goes through postpartum, symptoms, after delivering the baby. So as a mother
Hmm,
and as an Ayurvedic
hmm,
expert, what do you suggest for
hmm.
this mother on our, topic is like first 90 days in infant's life from
Hmm.
Ayurvedic perspective, but I want to first understand for mothers, what would you suggest?
Okay, okay. So for mothers, what I feel, the already 9 months she has been into so many troubles. So even after delivering the baby and everything, being very, very honest, it is not a very fantasy because you're going through a lot of stages in your life and phases of life where everything is very new, especially for a first mother. When you have a second baby, you're all prepared, but for mothers who are delivering for the first time, it is a little not so easy and not so good experience, being very, very frank. So now what care should be taken, and how should we go through this mode of life with Ayurveda? Very simple. First of all, I would like to say that before delivering the baby, there are few precautions that we need to take. So, example, we all know, and I think everyone is very, uh, I think very, they think a lot about, that how my pregnancy will be and, what I have to eat. They're very, very careful. And sometimes, being very frank, they're over careful. We stuff ourselves with a lot of things, saying that, okay, the baby needs a lot of nourishment. And so we end up eating a lot of things unnecessarily, and we land up in many diseases even during pregnancy. So what's important is your diet and your mind during pregnancy is very important. Let me tell you, nothing has to be taken very, very seriously in life.
Okay.
It's God's beautiful experience given to you. Take it very lightly, very positively, and yes, attentively.
Okay.
So we have to be just attentive and not over, thinking about what will happen next. So we just need to be attentive, saying that we have to eat normal food, ghar ka khana, like you can have everything, but everything is homemade,
Mm-hmm.
right? So there is no restrictions, there is no number of calories to be taken extra for your baby. No, no, no. It's just you don't need to be hungry
Mm-hmm.
because you are having a life in you. You need an extra calories, you need an extra nourishment, that's for sure. So we add up few things like a nourishment food is added, like we add ghee in your diet, which is a little extra. You add almonds, you add nuts, you add dry fruits, and which are little nourishing. So you add a little bit of milk also in your diet because it is a complete meal and it gives
Mm-hmm.
you all kinds of minerals and nutrients and everything for sure. So I would not go back to the pregnancy stage, but yes, taking care of yourself with the diet and everything, and especially your mindset in your pregnancy will definitely help with a better generation to come. And next, what I feel is that in the seventh month, it's said in the text of Ayurveda that you start eating food that helps in lactation, because
Mm-hmm.
that is a time when your ducts, your lactating ducts are actually getting prepared in your seventh month, eighth month, and everything. So that is a time when we say that we give some kind of herbs to the pregnant lady, which will increase the lactating part. So as I told you, the methi ka laddu hai, or stuff like a lot of Ayurvedic herbs like shatavari, ashwagandha, and everything that we include in the diet before pregnancy only is
Mm-hmm.
very, very important. So when you eat that, when you stuff that, then after delivery, definitely it gets smoother. So there
Mm-hmm.
are a hell lot of problems that I'm not getting milk, or my baby is not getting proper sleep, and these are the things that you need to take care before pregnancy.
Okay.
Now, post pregnancy, I would like to say one thing is that there is a whole emotional drama because your body is going through a complete 360-degree,
Yes,
a
absolutely.
change. Yes. So what happens is there is a lot of hormonal imbalance. You feel lonely. You feel helpless. That's the stage. You
Mm-hmm.
literally feel helpless because it's a new being. You don't know how to do. There are a hell lot of people telling you what to do, which you don't want to hear
Yeah.
you know so there's so much irritation, emotional imbalance for a female going through that period. Now what is important is to stay calm and prepare yourself for this phase. So
Mm-hmm.
when you come near your delivery dates, you prepare your mind that everything is going to happen in this manner, and mentally stability is very important. Apart from that, uh, just enjoy the phase, seeing the baby, and a good connection is very important with the baby. It's very important. The moment it comes out of your womb, connecting yourself as a mother with a baby, communicating, and especially the baby doesn't really understand at that particular time. The feel, the touch is very, very important. That is how you connect with the baby. So once you do that, you're definitely a hormones change. The happy hormones come back, and you start feeling lighter. And apart from that, a diet, if I say again, it's a big, huge topic, but I would say eating a healthy, wholesome food. And this is the time you need a little extra nourishment and little extra calories of food because you are lactating the baby. So your milk production should be good. For that reason, you should eat optimum. I mean, a little more than what normal you're eating. So lactating mothers should be eating well, that's for sure.
Okay.
And yeah.
Yeah. So yeah, so that was my next question precisely because nowadays, a lot of mothers uh, not have a normal delivery, but they have C-section, and that's when there another challenge comes about lactation and not enough producing milk. So from Ayurvedic perspective, what specific things would you suggest to our listeners, of in terms of food that they should eat, so they get proper enough milk production for the baby?
Yes. So again, in Ayurveda, when it said that milk production takes place before
Yes,
delivery
yes,
itself. So your entire 9 months are very important. And what food have you eaten? What is the quality of food that you have eaten? Will definitely produce the particular quality of milk.
mm-hmm.
Okay. So having a wholesome food and homemade food and very good quality food at home in pregnancy will again help you in good production. And as I told you, in the seventh month, seventh, eighth, and ninth month also, you're going to eat a lot of stuff that are homemade and at grandmoms, whatever they prepare for increasing the milk is very important. So as I told you, some wholesome foods like meathi seeds, fenugreek, even after delivery, you should be eating
Okay,
fenugreek seeds soaked in water.
okay,
Huh. See, very simple. So soaked in water, and you can have the water. Okay, you
okay,
can do that. Or else it's crushed methi seeds can be put, or it's powdered and then can be made into a laddu or any kind of a just a snacker that you
mm,
can eat anytime. That
okay,
that is important.
okay,
And along with that, a lot of ghee is very important. You
okay,
know, ghee is a sneha. It's kind of an fat which improves the amount of rasa dhatu. Rasa dhatu means the nourishment of a female.
mm-hmm.
So ghee is again very important. Jaggery is very important. So
Okay,
jaggery, methi, ghee, very simple, homemade that we can definitely take from our kitchen.
okay,
Apart from that, what you can take is flex seeds. They're also very important. फेनल सीड्स
mm-hmm.
फेनल सीड्स आर वेरी इंपॉर्टेंट फेनल मतलब बडी सोप जो होता है
Mm-hmm.
उसका पाउडर भी बहुत जन आफ्टर डिलीवरी दे हैव दैट हेल्प्स इन इम्प्रूविंग द मिल्क प्रोडक्शन जिंजर है गार्लिक है दिस इज समथिंग दैट यू नीड टू इंक्लूड इन योर डाइट डेली डाइट
Mm-hmm.
like a normal sabzi roti, you start adding a little bit of garlic and ginger so that again it helps in producing your milk.
Okay,
Very important is direct milk. So a milk should be consumed. 500 ml of milk twice a day should be definitely consumed by a female who is lactating.
okay,
So there is no necessity that that you itna amount ही पीना है. No, no, it's up to the body demands. Sometimes I must tell you it all depends on the body of an individual.
mm-hmm.
So a lot of poor people also, without eating anything, they produce a very good amount of milk, and that's God's blessed. But what I feel is that your mental stability, your mind is very important in producing your lactation also. Sometimes, a depressed female, emotionally extremely low female will not produce the good amount of milk.
Okay,
Even sometimes people like who are starving themselves because they are very females are very hesitant, saying that I'm putting on weight post pregnancy. So when they start starving themselves, that is the time again the amount of milk is deprived.
okay, okay,
So few things we need to take. Your mind has a very big role in amount of preparing the amount of milk production, because
mm-hmm.
milk production takes place in your brain, and that is where the signal comes in the breast,
Ah,
and that is how the milk is coming. One more important point is the connection with the baby is very important. Now,
mm-hmm.
example, there are nannies at home nowadays, and your
Mm-hmm.
baby is connected to the nanny all the time. Now, when you take the baby to yourself and you put the baby near to your chest, it's been said in Ayurveda that the moment the baby touches your breast, your milk production should come at the
Okay,
maximum.
okay,
It's a natural indulge. I mean, it's a natural thing to come from your own body. That is what the connection is all about. So it's all the mind game. It's also about the food. What I told that few things that you can
mm-hmm.
add in your diet
Huh.
that plays a very crucial role. So even if you have a C-section, it doesn't mean that you're not going to have a proper milk production. No, no, no. It's just what a diet what you had all this time. It's very important.
Okay. So now a lot of babies have these gastric problems because, uh, irregular in eating and all those things. So from Ayurvedic perspective, what would you suggest to mothers, who have kids who get gastric problems and burping problems?
Right, right. And this is also very important. Now we say that, when an infant is born, it is born out of a combination of as we all know that it's a combination of a parent, both the parents, like a male and a female. So the child has got a chromosomes of both the parents, right? So he or
Okay.
she is going to have all the quality of mother and father in terms of digestion. Okay, so whatever the quality of the body of a mother or father is, accordingly is the body of the baby,
Baby.
and
Okay.
that is what we can say for the first 3 months. And uh, how do we nurture the baby for the next 3 months? Will develop its own body,
Okay.
right? So when the baby is born, he or she is born out of the bodies of two individuals. So he'll have the qualities of the two individuals. So it's very important that as a mother or as a father, our own health should be extremely good so that the baby which comes will definitely have a good health.
Mm-hmm.
Now, a lot of babies complain of, not good digestion. They're not very born with a very good digestion. That is because of the food habits of the mother. So
Okay.
we not only to blame the mother. Why always the mother?
Yeah.
It's said that yeah. So overall, the mother and the father both should have a very good digestive system. And if we are unfortunate, even after doing everything, the baby still doesn't have a very good tummy, and it's just that you don't overfeed your baby. Just take care that you don't really
Okay.
overfeed, because we are very as a new mothers, we are very very inside. We have a lot of we're very anxious,
Yeah.
that okay, the baby is cranky. Should I feed her more? We don't really know. So what is the simple thing is that um, you feed the baby every 2 hours, right?
Mm-hmm.
One thing. And as we all know that you have to put the baby in one breast, empty the entire breast, and then the next time you take the baby to the next breast.
Mm-hmm.
Okay. Now, when you do that, the baby doesn't, you know, he or she, the baby gets the proper amount of milk, what is produced from one breast. Because initial milk of the baby that comes milk of the breast what comes out is little watery, and then after 2 or 3 minutes comes a little thicker, and
Okay.
then comes a proper milk. So a minimum of 10 minutes or 15 minutes of milk or 20 minutes ideally from one breast should be given, because if only we give 5 minutes from one breast and then we switch on to the next breast, what happens is the baby is getting only the water part,
Okay.
and then there are complaints of diarrhea. It actually comes out of the digestive system, and that is the time when the baby is a little cranky. So this is very important. Lactation knowledge, as we must have discussed the last time also,
Mm-hmm.
is very important for digestion of milk for
Very
the baby
important.
also. Apart from that, burping the baby is very important.
Mm-hmm.
Every time we forget, we don't really we feed the baby and we keep it aside. You have to burp the baby. Just keep it on your neck,
Mm-hmm.
and slowly in the downward direction you have to tap the baby so that it gets burped very fast.
Okay.
And sometimes it's not to be very anxious. Even if it doesn't get burp all the time, it is okay.
Okay.
Okay, but yes, maximum time the baby should get the burp within 5 minutes or 10 minutes also. It's
Okay.
okay.
All right.
And then you can, yeah. One more thing I just want to add is that a lot of people add a little bit of, and what I say, anti-colic medicines in the milk and give it to the baby. That also could be done if there is a lot of pain, and the baby gets the entire stomach becomes very tight
Mm-hmm.
sometimes, the bloating and everything. So what we do is generally in that stage, as an Ayurvedic doctor, we give some kind of medicines or simple things. You can add body soap powder also with the milk, and you can give to the child at that. I mean, at that period of time also, at any age, say
Mm-hmm.
about just born baby also we can give, not a problem.
Oh, all right. That was a good tip, Dr. Tejal. So now it leads to me, another question. Like, in India, we have services of, massage giving, someone who's an expert and, gives the nice massage to the baby and a bath, and then she makes her sleep. That is, we are fortunate we have in India, but in other countries like, US, UK, Australia, there's no services such as such. Okay, you won't get people who will come and do it for you at at a reasonable cost.
Right.
So from the Ayurvedic perspective, there are two questions that I want to ask you. First, is massage important to give to the baby, newborn baby? And B, if yes, then how do we give them? Can mothers do that massage? So yeah, that's the question to you.
Okay. 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 So massaging a baby is again a very big question, because there are so many myths about it, saying that should we do it or not?
Yes, yes.
See, first I'll tell you the let me just tell you the advantages, and then we'll go back why saying no to a massage. So, uh, firstly, in Ayurveda, massaging is about sneha. It's about oil. It's about massaging the body with some kind of a fat. Now, fat in Ayurveda is called as sneha. Sneha means love. The word itself is sneha. So, oil, fat, anything that can be applied to the baby or to an adult is very, very important. Why is it important? Because it improves the texture, the overall complexion of an individual. So when we are massaging the baby, the circulation increases, the well-being of an individual improves. Okay, longevity of an individual improves. Uh, then the overall immunity of the baby also improves with the massaging. Very important. It sleeps well. So sleeping the baby, keeping the baby safe, guarded, because it feels really very, very good while massaging. That is also very important. And when the baby sleeps, there is a lot of brain development while sleeping. So again, it helps in the overall development of a baby. That is important.
Mhm.
Again, I would say that uh, that mothers are the only one should be doing this kind of an activity. I mean, massaging the baby is very important. So yes, in India we have got a lot of people who come and do it for us. That's because after delivery, the mother doesn't directly can't. She's not in a state of mind to actually go near the baby
Yes.
and massage, because she herself is not in the stage. But in that case, it could be your near dear ones who will be doing, and doing a bath for the baby 1 or 2 days. The third day or the fourth day, when the mother herself is able to stand up and do the normal activity, she can take the baby and she can massage. So massaging here is not about putting all your pressure there. It's just about taking little oil in your hand, and preferably there are so many oils in the market. So it could be, what I prefer is a sesame oil, plain sesame oil. You just warm it and apply it. It could be coconut oil. It could be anything that is localized. So where you are staying is very important. If you're staying
Okay.
in the south of the India, you can apply coconut oil. That's there in the local market. If you are staying in the north, you can take mustard oil, because that is what people
Mustard
do it
oil.
there.
Yes.
You know,
Yes.
and definitely, when you are in the mid range, you can use sesame oil, because that is the best oil. That is the I can say it suits all skin types. Okay, so you can take that, warm a little, and you can just massage well. There are a lot of Ayurvedic herbal oils, medicated oils that are there in the market, which has a base of sesame oil, and in which there are medicated herbs that are put, and that helps in the proper muscle growth and the bone development of a baby. So that you just have to apply. Now, applying is very important. As you asked me that, how can you do that? It's just that you need to just apply very gently in the body, on the body. Uh, Especially the strokes are very important. So it's like in the downward strokes, you have to apply oil that is in the direction of hair.
Okay.
Okay, so not against the direction of hair. It's just about in the direction of hair. You have to apply oil very gently is very important. Now, let me tell you, when we have other ayahs or people who come and massage our baby, it's in a very vigorous way. So they just generally do it very very fast, a little more pressure, saying that okay, they have a better circulation of blood, and which is I don't really suggest that. So what is the basic traditional way of applying or massaging is just that you apply oil and all over the body, from the tip, I mean from the head to the toe. You have to apply it. Head massage is also very important. It The nervous system and everything gets you know stimulate is
Mhm.
there is a lot of stimulus generated when you do that. And your eyes, your nose, your lips, your cheeks, the entire face, your Limbs are very important. Limb massaging should be done in the downward direction only. When you're massaging the stomach, you have to apply oil in the clockwise direction. Okay,
Okay.
so हमारा जो intestine होता है उसके direction में ही you have to apply oil. Again, backside in your spinal, again you have to from up to downwards you have to massage the baby, and you have a muscles which are going sideways. So applying oil in this direction from middle to outside is important at the back.
Okay.
And in the joint area, especially your joints and everything, a circular motion is very important. So the simple tips: joints you have to apply circular, on your tummy or abdomen circular, on your arms and your limbs straight, downward direction. Your spinal region is also downward direction with little bit of outward direction at this back muscles.
Fine. Okay.
This simple technique to be done very gently, and this is to be done by a mother because again, and this is important, is your hand movement. You know, finger when you use it, the baby feels the particular the touch of the mother, and it doesn't forget. It remembers the touch of the mother, and that is how the connection has been built between the mother and the
Mhm.
child. So when it has been done by the mother, it feels more secured. And when they hear it, when they hear the voice of the mother, they feel more secured, and that is how they don't get agitated while doing a massage. That is a big problem now in
Mhm.
children, that they don't let others do it. So when you start
Mhm.
with the mother only, from the day one, it becomes much more easier. Now, one more thing again I want to important is there in massaging, which I said that disadvantages. So in allopath or in modern science, it's absolutely been said that you don't need to do it for the reason there are a lot of infections being found in people. You know
Mhm.
that okay, when you massage a baby, there is a lot of bacterial infections. There are a lot of doctors who say that okay, there are uh, uh, I can say skin disorders because of massaging the baby. So avoid it. There's no need. So yes, if you don't do it, there also you. It's not that the baby is not going to grow well or something. No, but this is something that I want to say is that it all depends on the body constitution of the baby. So sometimes it is that the baby is pitta prakriti pradhan, or it is more of pitta dosh in the body. So definitely it won't allow the oil. It will not allow any kind of a substance to be, because it's very very sensitive skin.
Mhm.
So that
Mhm.
all depends on the constitution of the baby. So when it is more of a kapha pradhan, also it will not. The moment you put oil and everything 2-3 days, the baby gets fever after 2 to 3 days. That's because of the constitution of the baby. So that's a rare case. In a generalized case, especially the babies are vata dosh pradhan on the skin. So that is the time you have to apply oil. Okay. There are rare cases in which, especially even in Ayurveda, it is said that a baby is not well, has got cold, cough, you should not massage, you should not do oil massage. If he has got any kind of a disease, you should not massage. So there are contraindications also when to be done or when not
Okay.
to be done. But ideally, for overall development, you have to massage
Sure.
the baby.
Thank you, Dr. Tejal, for giving very detailed answer for this. So that gives me another question for you. Is nowadays, again in India, we tie the baby after giving the nice massage and bath, and then make baby sleep. So from Ayurvedic, do you think it is important, and why?
Okay, so tying the baby is also an old tradition that we all follow, and that is called as swaddling the baby. Now, swaddling the baby is important because when the baby is born, it has a tendency to startle. Startle means chamak jana.
Mm-hmm.
You must have seen a lot of baby.
Yeah.
In the sleep they start doing that. That's because that's a normal reflex of the baby when it is inside
Mm-hmm.
in the womb.
Mm-hmm.
So when it comes out, it is and inside the womb there is an amniotic fluid outside. So they don't really get shocked because of the amniotic fluid.
Mm-hmm.
Now, when it is outside, they don't have that kind of a protection because they are completely out in the air. So when they have that kind of a reflex that is startling, they actually wake up, and that is a big disturbance in their sleep. And
Mm,
that is the reason they have been, it's very important to swaddle the baby and make the baby sleep. And as we all know, sleeping babies are the best because they have a total development of overall body when they are sleeping at an
mm,
early stage,
mm,
especially the first 3 months. So one important point while swaddling is that it's going to improve their health. Apart from that, does not disturb their sleep.
mm,
Okay. And other thing is when you swaddle, they feel more comfort. They feel very secured. So that feeling of security is also very important because they are completely in the womb. They are completely bended, and they are more cuddled. And that is the thing that we also need to follow up post delivery. So that is the reason we swaddle the baby. And uh, see, one more thing, these things are very traditional. So whether we should be doing or not, it all depends on an individual. There are many people who don't really do it. Okay, maybe in the initial time, but after 3 months they remove it. But it's all about securing and the mental stability of the baby right from birth. So this is just care we are taking it, and that's the reason we swaddle the baby. That's it.
all right. So I finish. I'm done with all my questions. So now I leave it. If any of our participants want to ask any particular question to Dr. Tejal, she's happy to reply. Meanwhile, Dr.
Yes, yes,
Tejal,
I
please
will.
put your email ID in the chat box. So if people wants to connect to you one to one and ask you specific question, they can do so.
I will do that.
Yeah. Okay.
So yes, I put my email ID. Any questions, you all can definitely write me here.
Yeah. So they can connect to you one to one. Okay. All right. So thank you, Dr. Tejal, for giving such a
Thank you. I
beautiful.
had a very great time.
These are simple questions, but a lot of parents, new mothers have a doubt about it, whether to do it, not to do it. So I think listening to this, viewing your information, your expertise, people have got idea and they can now decide what to do. So it's up to them, but it's a good insight. Thank you so much.
Thank you. Thank you for inviting me, and I hope we all connect again for the next sessions. I
Definitely.
had a very great. Thank you so much, and you are doing great. So keep up the great work.
Thank you.
It's nice seeing such kind of discussions happening, so that it becomes very easy and very because it's just like you have to click and you have to listen to someone who can give you a lot of knowledge about
Yeah.
these things. So
Thank
great
you.
work. Thank you so much.
Thank you